Think you know medical English? If you don't know these 50 medical English abbreviations, you could miss vital patient information, and fast. Hi, I'm Jer and welcome to Learning English Pro, the home of medical English on YouTube. Today we're diving into 50 of the most common medical abbreviations you'll find in any English language hospital or clinic. This lesson is great for nurses, doctors, or anyone working in a healthcare setting. We'll cover 10 essential categories to really get you started on understanding just a few of the thousands of abbreviations you'll find in medical English. And if you want more lessons on medical abbreviations, let me know in the comments. Each of the 50 abbreviations we'll cover will come with an explainer and a real example sentence to help you use the term confidently. There's a lot to take in here, so come back and test yourself anytime. And don't forget to like, subscribe, and share it with your healthcare colleagues. For my amazing student members, head over to the membership tab for your copy of the full guide. It has all the learning content from this lesson, plus a huge glossary of 100 terms and additional exercises to boost your knowledge. If you're not a student member, you can join right now. The link to join is in the video description. The guide for this lesson is also available in my YouTube store. Everything is linked in the description. Okay, that's enough business. Let's get down to our abbreviations. If you really want to use abbreviations appropriately, listen up. Some abbreviations in medicine are only written in notes or charts. Some are spoken out loud in hospitals or clinics, and many are used both ways. So, as we go through the list, I'll tell you whether each abbreviation is typically written, spoken, or both, and I'll highlight that clearly for every single one of them. Now, how I pronounce them in the example sentence depends on how they're actually used in conversation. If the abbreviation is usually said as the full word, I'll say the full word. So for the abbreviation or X, you'll hear me say, the doctor wrote a prescription for antibiotics. But for something normally spoken as the abbreviation, like CPR, I'll say, the patient collapsed and CPR was initiated immediately. This way, you'll hear what native speakers would actually say, not just what's written down. If you're confused, pick up a copy of the guide. It's all laid out very clearly. Now let's jump into our first category, which is vital signs and monitoring. Our first abbreviation is BP, which stands for blood pressure. This is used in both spoken and written English. It means the force of your blood pushing against the walls of your arteries. Let's take a look at our example sentence. The patient's BP is dangerously low at 80/50. Our next abbreviation is HR, or heart rate, and this means the number of heartbeats per minute. HR can be used in both spoken and written English. Our example sentence is, monitor the HR and report any changes above 100 BPM. BPM is another abbreviation meaning beats per minute. Let's move on to or respiratory rate. This relates to the number of breaths a person takes per minute, and we can use or in spoken and written English. Our example sentence is, his or increased to 26 after the procedure. Our fourth abbreviation is written only. It is written as SpO2. And it refers to oxygen saturation. Oxygen saturation refers to the percentage of oxygen in the blood. Let's take a look at our example sentence. Her oxygen saturation dropped to 91%, so we began oxygen therapy. And abbreviation number 5 is our shortest abbreviation in our list, T for temperature. And of course, temperature relates to the body's internal heat, usually measured in Celsius or Fahrenheit. We can use the T abbreviation in both spoken and written English. Our example sentence is, patient's T is 38.6 degrees Celsius, indicating a possible infection. So, well done. Those first 5 abbreviations are essential for assessing patient stability. They're critical English for every member of the medical team. Let's have a quick quiz question. Which abbreviation refers to the percentage of oxygen in the blood? The correct answer is number 4. Well done if you got that right. Okay, let's move on. But before we do, if you haven't subscribed yet, click the button to stay updated on all my medical English lessons. The next topic is a really interesting one. It relates to body systems and assessments. Our first abbreviation is CNS. This refers to the central nervous system, and this abbreviation is both written and spoken. We're checking for signs of CNS depression after the overdose. Next up, number 7, we have CVS, which relates to the cardiovascular system. This is the heart and blood vessels working together. And again, CVS can be used in written and spoken English. He has a history of CVS disease, so monitor his vitals closely. Number 8 is GI, or gastrointestinal, relating to the digestive system. Again, GI can be said or written in English. The patient reports GI discomfort after eating. Our 9th abbreviation is GU, or genitourinary, which refers to the urinary or genital organs. A GU infection is suspected due to the presence of blood in the urine. So here you can see it's written and spoken. Our 10th abbreviation is MSK, or musculoskeletal. This abbreviation refers to muscles, bones, and joints, and again, it can be written or spoken. She has MSK pain following a workplace injury. Great job! These abbreviations help you speak clearly about different systems in the human body, super important when communicating across departments. Let's have a quick quiz. Which abbreviation is used when referring to the heart and blood vessels? The correct answer is CVS. If you got that right, give yourself a pat on the back. If you're finding these abbreviations challenging, don't worry, they are very tricky. But if you download the guide that's available for my student members or on my YouTube store, you'll give yourself a really good boost in this area of medical English. Okay, next up, we're covering abbreviations relating to medical history and patient notes. Our first abbreviation in this category is written only. HO, or history of. This refers to a patient's past conditions. Our example sentences: patient has a history of hypertension and diabetes. And next we have DC, which can mean either discharge or discontinue. This abbreviation can be written or spoken, and depending on the context, means to release or stop something. Our example sentences: the patient was DC'd yesterday afternoon. Next we have NKA, or no known allergies. This indicates no allergies have been reported by a patient. This is a written abbreviation. Our example sentences: she's no known allergies, so we proceeded with the standard antibiotic. Also written is NKDA, no known drug allergies. This specifically states no medication allergies for a patient. Our example sentences: no known drug allergies, administered amoxicillin. Next up, we have SOB, which means shortness of breath or difficulty breathing. SOB is used in written and spoken English. Patient presented to the ED with acute SOB. You're doing amazing work. These kind of abbreviations you'll see constantly in patient records. Here's your next quiz. What does NKA stand for? The correct answer is no known allergies. Nicely done if you got that right. If you're finding this lesson helpful, make sure to click the like button and share it with a colleague. Maybe watch it together and have a chat about all the different abbreviations you're learning. Our fourth section covers abbreviations used for tests and investigations. And all the abbreviations in this category can be both spoken and written. And first up, we have CBC. This relates to the complete blood count, a test that evaluates overall health and detects disorders. The CBC showed elevated white blood cells. CMP, or Comprehensive Metabolic Panel, is of course the blood test measuring glucose, electrolytes and more. We ran a CMP to check her kidney and liver function. We also have the abbreviation CXR, or a chest X-ray. And of course, this is an image of a chest to check lungs and heart. A CXR was ordered to rule out pneumonia. MRI, as an abbreviation, stands for magnetic resonance imaging. This is a scan to produce a detailed image of organs and tissues. Our example sentences: an MRI was scheduled for the patient's lower spine. Our 20th abbreviation is ECG, or EKG. This refers to an electrocardiogram, which measures the heart's electrical activity. The EKG showed signs of atrial fibrillation. Brilliant! These abbreviations are vital for interpreting results and ordering tests. Let's check your knowledge. Which abbreviation refers to a test that checks your blood for white and red cells? Did you get it? The correct answer is CBC. Great work! Don't forget, you can pick up a guide for this lesson as a student member on my channel. Student members get access to every PDF I've ever written for this channel and every new one that comes along. There's also 300 members-only videos on my channel. That's 300 English lessons waiting for you right now. The link to join is in the video description. Our next topic focuses on medication and prescriptions. First up, we have RX, a written abbreviation. This means prescription, a written order for medicine. The doctor wrote a prescription for antibiotics. PRN is our next abbreviation, and it can be both written and spoken, and it means as needed, a medication given only when necessary. Morphine, 5 mg PRN for pain. BID stands for twice a day. It's from Latin, and this one is written only. Take this tablet twice a day with food. Similarly, we have TID, also from Latin. This means 3 times a day, and this one's also written. Our example sentences: prescribed 250 mg 3 times a day for 5 days. Our final abbreviation in this category is IV, or intravenous. This is spoken and written. And this means that something like a medication is delivered directly into a vein. Our example sentences: administered IV fluids after dehydration. Wow, that's another powerful batch of abbreviations you've learned, especially for anyone handling medication. These abbreviations help keep drug instructions short but clear. Are you ready for quiz time? Which abbreviation means a medication taken 3 times a day? The correct answer is TID. Well done. Have any of the abbreviations surprised you so far? Have you seen one before and now you really understand what it means? Let me know in the comments below. I'd love to hear from you. Our journey through medical abbreviations takes us to emergency terms. And all the abbreviations in this section can be both written and spoken in English. And first up, we have CPR, or cardiopulmonary resuscitation, and of course refers to a life-saving procedure for cardiac arrest. The patient collapsed and CPR was initiated immediately. AED. This refers to an automated external defibrillator, a portable device that delivers an electric shock to restart the heart. We used the AED before the ambulance arrived. LOC stands for loss of consciousness. This means when someone becomes unresponsive. He experienced LOC for approximately 30 seconds. Our next abbreviation is one you'll always hear in the movies or in TV shows. STAT. This means immediately. It's a command for urgent action or results. We need a stat ECG. He's not stabilizing. Our 30th abbreviation is BLS, or Basic Life Support, a level of emergency care for unresponsive or non-breathing patients. All healthcare workers are required to maintain valid BLS certification. Well done. Those last 5 abbreviations are really crucial in emergency medicine. They are critical English for every member of the team. Let's have a quick question. Which abbreviation is used when a procedure or result is needed urgently? And yes, the correct answer is STAT. Well done if you got that right. Let's move on to category number 7, nursing and monitoring. And all the abbreviations in this section, apart from the last one, are both written and spoken. ADL refers to activities of daily living. This means basic personal care tasks like eating or bathing. She needs assistance with all ADLs following her stroke. INO refers to intake and output. This is the measurement of fluids consumed and excreted. Our example sentences: please document INO every shift for this patient. NPO is nothing by mouth. This is a restriction on eating or drinking. The patient is NPO ahead of surgery. VS means vital signs. These are key indicators of patient's health. Our example phrase is: record the VS every 4 hours post-op. And our last abbreviation in this category is written only, Q4H, which means every 4 hours. This is a frequency of checks or for medication. Vitals must be taken every 4 hours on this ward. Excellent work, well done. Those abbreviations appear constantly in nursing notes and charts, so getting familiar with them is a must. Quick quiz. What does NPO mean? Did you get it right? The correct answer is nothing by mouth. Great job if you remember that. If you're finding this lesson useful, make sure to hit the subscribe button. It really helps the channel. Next up, let's go over abbreviations related to labs and fluids. And in this section, all the abbreviations are written only, except for the last one. First up, we have Na+, which stands for sodium, an important electrolyte in the blood. The sodium level was slightly elevated after dehydration. Next, we have a K+, which means potassium, which is another key electrolyte for nerve and muscle function. Low potassium can lead to arrhythmias. Watch those levels closely. BUN stands for blood urea nitrogen. This measures kidney function. The blood urea nitrogen result suggests reduced kidney filtration. The abbreviation CR stands for creatinine, another key indicator of kidney health. Her creatinine levels have improved since starting treatment. Next up we have IVF, which stands for intravenous fluids. These are fluids delivered directly into a vein. We started IVF to stabilize her after blood loss. Now just note, IVF on the street is commonly known to refer to in vitro fertilization. So just make sure you understand the context in which it's been said. Well done, brilliant stuff. All of these terms are often seen in lab reports and fluid balance charts. They're essential for understanding patient hydration and kidney function. Okay, it's quiz time. Which abbreviation refers to fluids given through a vein? And yes, it's the last one we just had, IVF. Excellent if you caught that. Well, we are soaring through all of our abbreviations. Well done for sticking around this far. We're at our final 10. And our next category is category 9, admissions and transfers. And all of the abbreviations in this section can be both written and spoken in English. ED refers to the emergency department, the hospital area for urgent care. The patient was brought to the ED with chest pain. ICU. This stands for Intensive Care Unit, a unit for critically ill patients. He's being transferred to ICU for closer monitoring. L&D stands for Labour and Delivery, the unit where childbirth occurs. She was admitted to L&D at 38 weeks. Our next abbreviation is OBS. So we don't say OBS here, we say OBS, which is short for observation, a period of monitoring without full admission. He was kept in OBS overnight for further evaluation. Abbreviation number 45 is AMA, Against Medical Advice. This is when a patient leaves the hospital without approval. She signed an AMA form and left before discharge. You're doing so well. These abbreviations help staff coordinate where patients are and how their care is managed. Let's try another quiz. Which abbreviation is used for patients who leave hospital before being discharged by a doctor? And yes, the correct answer is AMA. Give yourself a clap on the back. Our final category includes some very important terms used in legal, safety, and communication settings. And all of these terms can be used in both written and spoken English, except the very last one. DNR stands for Do Not Resuscitate. This is a legal order to not perform CPR. The chart includes a signed DNR order. HIPAA is an abbreviation which stands for Health Insurance Portability and Accountability Act. This is a US law protecting patient privacy. Sharing patient info without consent breaches HIPAA. SBAR stands for Situation, Background, Assessment and Recommendation. This is a type of communication framework for handovers. Use SBAR when calling the doctor with a concern. PPE. This stands for Personal Protective Equipment. This refers to all the safety gear like gloves, masks and gowns worn in a hospital setting. Always wear PPE when dealing with infectious patients. And our final and 50th abbreviation is QA, which stands for Quality Assurance, and this abbreviation is generally written. It means a system to maintain healthcare standards. The Quality Assurance audit revealed gaps in medication tracking. Well done. You made it to the end of all 50 abbreviations. You have done absolutely fantastic. If you're a student member, head over to the membership tab right now to pick up the guide for this lesson. It's great for further study and includes an extensive glossary and 3 additional exercises to really boost your comprehension around these medical abbreviations. And if you're not a student member, don't worry. You can pick up the guide in the YouTube store for just $4.99. I hope you enjoyed this lesson on medical abbreviations. There are thousands and thousands of medical abbreviations out there in the world, so if you want me to do more lessons on them, just let me know in the comments below. I'd love to hear from you. Don't forget to like, share and subscribe. Don't go anywhere because I'm including 2 additional lessons in this video. First up, you're going to learn 100 medications in English, a really useful lesson for nurses, doctors and healthcare workers. And then I'm following that up with my latest lesson, 100 English phrases for medical interpreters, an essential class for anyone learning English in a medical context. I'm Jer, this is Learning English Pro, and I'll catch you in the next lesson. Today we're diving into 100 common medications, learning about different types of medications, their uses, symptoms they treat, and correct pronunciation. This lesson will help you sound confident and professional when discussing these medications in English. To make your learning even more comprehensive, I've created a PDF guide for this lesson, which includes all the content we'll cover. This guide is available exclusively to student members of my channel. Becoming a member gives you access to much more: the PDF guides, early video access, online games, quizzes, weekly flashcards, and additional resources on the way. It's a fantastic way to take your learning further and get even more value from each lesson. If you're interested in these extra tools and support, considering joining the student membership for the price of a cup of coffee. It's a great way to support the channel, deepen your English language skills, and stay connected with all the new content on the channel. Now let's get started with our lesson on 100 common medications. We will go through 20 different types of medication, starting with an explanation, followed by a list of example medications, and then some example English sentences. If you are looking for healthcare advice on medications or symptoms, then ask a healthcare professional like a doctor or a nurse. So if you're ready, let's get started. Our first medication type is anesthesia. Now on screen you can see here that we have two different spellings, one for American English and the other for British English. Anesthesia is used to induce a loss of sensation or consciousness, often for surgical procedures. These medications may be general, affecting the entire body, or local, targeting a specific area. Anesthetics are essential in pain-free medical interventions. Different types of anesthesia include propofol. This is used for general anesthesia and is commonly known as the Michael Jackson drug. Lidocaine. This is a local anesthetic, often used in dental procedures. Isoflurane is a gas anesthetic commonly used during surgeries. Ketamine is a powerful anesthetic, also used in emergency pain management. Bupivacaine is a long-acting local anesthetic used in epidurals. Let's take two of these words and use them in example sentences. The surgeon administered propofol to induce general anesthesia before the procedure. For minor dental work, the dentist used lidocaine to numb the area. Our next category of medicine is painkillers, also called analgesics. These medications are ones that relieve pain. They range from mild, over-the-counter options to stronger prescription drugs. Painkillers are classified into non-opioid, opioid, and NSAIDs. Different types of painkillers include aspirin, a common over-the-counter pain reliever and anti-inflammatory. Ibuprofen. This treats mild to moderate pain. Morphine. This is a powerful opioid painkiller for severe pain. Acetaminophen, also known as Tylenol, is used for mild pain and fever. Codeine is an opioid used for pain relief and sometimes in cough syrups. After the surgery, the doctor prescribed morphine to manage the patient's pain. Ibuprofen is often recommended for reducing inflammation and mild pain. Our next medicine category is antibiotics. Antibiotics are medications that kill or inhibit the growth of bacteria, used to treat bacterial infections. They are not effective against viruses and should be only used as prescribed to prevent antibiotic resistance. Amoxicillin is a widely used antibiotic for bacterial infections. Azithromycin treats respiratory and skin infections. Ciprofloxacin is an antibiotic often prescribed for urinary tract infections. Doxycycline is used to treat various infections, including acne. Penicillin One of the oldest antibiotics is still used for specific bacterial infections. Let's take a look at our example sentences. The patient was prescribed amoxicillin for a bacterial throat infection. For skin infections, doxycycline is a common and effective choice. Let's move on to antidepressants. These are medications used to treat depression, anxiety, and certain other mood disorders. They work by balancing chemicals in the brain to improve mood, sleep, and energy levels. Our first antidepressant is fluoxetine. This is commonly known as Prozac. It treats depression and anxiety. Sertraline, known as Zoloft, is used for depression, anxiety, and PTSD. Amitriptyline is an older antidepressant, which is also used for chronic pain. Escitalopram, also known as Lexapro, is used for depression and generalized anxiety disorder. Venlafaxine treats major depressive and anxiety disorders. Fluoxetine is often prescribed for patients experiencing chronic depression. Sertraline is commonly used to manage both depression and anxiety. Our next medication classification is antipsychotics. This type of medication is used to manage psychosis, including schizophrenia and bipolar disorder. They help reduce hallucinations, delusions, and other severe mental health symptoms. Risperidone is used to treat schizophrenia and bipolar disorder. Olanzapine is prescribed for bipolar disorder and schizophrenia. Clozapine is used for treatment-resistant schizophrenia. Quetiapine treats both bipolar disorder and depression. And we have aripiprazole, which is also used for schizophrenia and bipolar disorder. The patient was given risperidone to help manage symptoms of schizophrenia. Olanzapine is effective for treating mood swings in bipolar disorder. Next up, we have antihistamines. Antihistamines relieve allergy symptoms by blocking histamine, a substance in the body that causes allergic reactions. They are used for conditions like hay fever, itching, and some respiratory allergies. Loratadine, also known as Claritin, is commonly used for seasonal allergies. Diphenhydramine, also known as Benadryl, relieves allergies and cold symptoms. Cetirizine treats hay fever and skin allergies. Fexofenadine is used for seasonal allergy symptoms. Hydroxyzine is used for itching and anxiety, often in short-term settings. Loratadine is effective for relieving symptoms of seasonal allergies. For severe itching, hydroxyzine may be prescribed as an antihistamine. Our next medication category is diuretics, also known as water pills. This type of medication helps the body eliminate excess fluid by increasing urine production. They're commonly prescribed for conditions like hypertension, heart failure, and kidney issues. Our first diuretic is furosemide. This drug is commonly used for heart failure. Hydrochlorothiazide treats high blood pressure and fluid retention. Spironolactone is a potassium-sparing diuretic used for fluid retention. Bumetanide is used to reduce swelling due to fluid buildup. Chlorthalidone is a diuretic often prescribed for hypertension. Let's check out our example sentences. The doctor prescribed furosemide to manage the patient's heart failure symptoms. Hydrochlorothiazide is commonly used to treat high blood pressure. Our next medication category is anticoagulants. These are often referred to as blood thinners. Anticoagulants prevent blood clots, reducing the risk of stroke, heart attack, and other cardiovascular issues. They are vital for patients at high risk of blood clots. Our first type is warfarin. Warfarin is a commonly used blood thinner. Next up, we have heparin, which is often used in hospitals for blood clot prevention. Dabigatran is an oral anticoagulant. Apixaban is used to reduce stroke risk. Rivaroxaban is a blood thinner for clot prevention. Warfarin is often prescribed to patients with an elevated risk of stroke. Apixaban is taken daily to prevent blood clots in high-risk individuals. Let's move on to anti-inflammatory drugs, otherwise known as NSAIDs. This type of medication is used to reduce inflammation, pain, and fever. They're commonly available over the counter and treat various conditions, from arthritis to headaches. Our first type of anti-inflammatory is ibuprofen. This is commonly known in the United States as Advil, a common NSAID. Naproxen is used for pain and inflammation. Celecoxib is often used for arthritis. Indomethacin is used to reduce inflammation in arthritis. Diclofenac is often prescribed for severe pain and inflammation. Ibuprofen is often used to reduce inflammation and treat mild pain. For joint pain, naproxen can be effective in reducing inflammation. Let's move on to antacids and acid reducers. This type of medication is used to relieve symptoms of acid reflux, heartburn, and indigestion. Antacids neutralize stomach acid, while acid reducers lower acid production in the stomach. Omeprazole is used for acid reflux and GERD. Ranitidine is commonly used for heartburn, but it is now discontinued in many markets across the world. Calcium carbonate, also known as the brand Tums, is an over-the-counter antacid. Famotidine is used to reduce stomach acid. Esomeprazole is used for acid reflux. Omeprazole is often prescribed for patients with chronic acid reflux. For quick relief, calcium carbonate can neutralize stomach acid on the spot. Let's move on to bronchodilators, or respiratory medications. This type of drug is one that helps open the airways in the lungs, making breathing easier. They are commonly prescribed for asthma, COPD, and other respiratory conditions. Albuterol is commonly used for asthma attacks. Ipratropium is used for COPD. Salmeterol is a long-acting bronchodilator. Theophylline is used for asthma and other lung diseases. Tiotropium is used for long-term COPD management. Let's check out our example sentences. During an asthma attack, albuterol provides quick relief by opening the airways. Salmeterol is often prescribed for patients needing long-term asthma control. Our next medicine category is antivirals. Antivirals are medications that treat viral infections by inhibiting the development of the virus. They are used for conditions like flu, herpes, and HIV. Our first antiviral is acyclovir. This is known as Civirix, and it's used for herpes infections. Oseltamivir, also known as Tamiflu, is used for influenza. Valacyclovir is used for herpes and shingles. Tenofovir is used for hepatitis B and HIV. Remdesivir is used for COVID-19 in specific settings. Acyclovir is prescribed to help manage herpes symptoms. For flu symptoms, oseltamivir is often recommended during flu season. Our 13th category of medication is anti-diabetics. Anti-diabetic medications help manage blood sugar levels in people with diabetes. These include insulin and various oral medications. Metformin is a commonly prescribed medication for type 2 diabetes. Insulin is a hormone used to control blood sugar, often injected. Glipizide stimulates insulin production. Sitagliptin helps control blood sugar. Next up, we have pioglitazone. This medication helps regulate glucose. Let's take a look at our example sentences. Patients with type 2 diabetes are often started on metformin to control blood sugar. Insulin injections are necessary for many patients with type 1 diabetes. Next up, we have corticosteroids, or commonly just referred to as steroids. These medications are used to treat a wide range of conditions, including asthma, allergies, and arthritis. They work by reducing inflammation and immune response. Prednisone is used for inflammation and autoimmune conditions. Hydrocortisone is available as a cream for rashes and inflammation. Dexamethasone is a powerful steroid used in severe inflammation cases. Methylprednisolone is used for severe allergies. And betamethasone is often used as a topical cream for skin conditions. Prednisone is commonly prescribed for patients with severe allergies. For joint inflammation, methylprednisolone can provide relief. Our next category of medication is laxatives and stool softeners. This type of medication helps relieve constipation by promoting bowel movements or softening stool, making it easier to pass. Psyllium, also known as Metamucil, is a fiber-based laxative. Next up, we have Docusate, which is a stool softener. Polyethylene glycol is used for constipation. There is also Senna, a herbal laxative available over the counter. Bisacodyl, also known as Ducalex, stimulates bowel movements. Let's check out our example sentences. First up, Polyethylene glycol is recommended for chronic constipation. Docusate is a gentle option for softening stool without causing cramps. Our 16th category of medications is antihypertensives, also known as blood pressure medications. Antihypertensives are used to control high blood pressure, reducing the risk of heart attack, strokes, and kidney disease. Lisinopril is an ACE inhibitor used to lower blood pressure. Amlodipine is a calcium channel blocker. Losartan is an angiotensin II receptor blocker, or A or B. Metoprolol is a beta blocker also used for heart rate control. Hydrochlorothiazide is a diuretic also used to lower blood pressure. The doctor prescribed lisinopril to manage the patient's high blood pressure. Amlodipine helps relax blood vessels, making it easier for blood to flow. Our next type of medication is muscle relaxants. Muscle relaxants relieve muscle spasms and tightness, often prescribed for back pain, muscle injuries, and other painful conditions. First up, we have cyclobenzaprine. This is a common muscle relaxant. Methocarbamol is used for muscle pain. Baclofen is used for muscle spasticity in neurological conditions. Up next, we have tizanidine, which treats muscle tightness. Diazepam, also known as Valium, is used as a muscle relaxant and anti-anxiety medication. Cyclobenzaprine is commonly used for relief from muscle spasms. For chronic muscle tightness, tizanidine may be prescribed. Our 18th category of medication is anti-seizure medications or anticonvulsants. This type of medication prevents or reduces the frequency of seizures. They are essential in the treatment of epilepsy and may be used for mood stabilization or neuropathic pain. Phenytoin is commonly used for epilepsy. Carbamazepine treats seizures and nerve pain. Valproate treats seizures and is also used for bipolar disorder. Up next, we have levetiracetam. This is a newer anti-seizure drug. Gabapentin is used for nerve pain and seizures. Let's check out our example sentences. Phenytoin is prescribed to control seizure activity in epilepsy. For neuropathic pain, gabapentin is commonly used as an off-label treatment. Our penultimate category is for antiemetics, also known as nausea relief. These types of medications are used to prevent or relieve nausea and vomiting, commonly prescribed for patients undergoing chemotherapy, surgery, or those with severe motion sickness. Ondansetron is a medication widely used to prevent nausea. Metoclopramide treats nausea and aids digestion. Prochlorperazine is used for severe nausea. Promethazine treats nausea and motion sickness. Scopolamine is a patch or tablet often used for motion sickness. Patients receiving chemotherapy are often prescribed ondansetron to manage nausea. Promethazine is a go-to medication for preventing motion sickness on long journeys. Our final category of medication is immunosuppressants. Immunosuppressants are medications that suppress the immune system, commonly used for patients with autoimmune diseases or those who have undergone organ transplants to prevent rejection. Cyclosporine is often used to prevent organ transplant rejection. Methotrexate is used for autoimmune conditions like rheumatoid arthritis. Azathioprine is used for lupus and Crohn's disease. Tacrolimus is often used for kidney and liver transplant patients. Mycophenolate is an immunosuppressant used after organ transplants. Cyclosporine is essential for patients who have undergone organ transplants. For managing autoimmune conditions, methotrexate can be an effective treatment. And there we have it. Thank you for joining me for this lesson on 100 common medications in English. I hope you found it useful in building your confidence with medical English. Remember, the key to mastering this vocabulary is practice and repetition, so feel free to revisit this lesson as often as you need. When you're interpreting in a hospital, your words are more than just translations. They are bridges between people, cultures, and care. Hi, I'm Jer from Learning English Pro, the home of medical English on YouTube. And today's video is a complete training tool for medical interpreters working in real-world settings. We'll go through 100 useful professional English phrases, all grounded in actual conversations from clinics, hospitals, and community health settings. This lesson is designed to help you sound more confident, stay calm in high-pressure situations, and provide the most accurate, human-centered interpretation possible. We'll break the lesson into 10 themed sections with 10 phrases in each. And I'll be giving you lots of quiz questions throughout to check your comprehension. So whether you're training, revising, or already on the job, you'll walk away with practical tools to use right away. For my student members, there is a fantastic downloadable PDF version of this lesson, complete with exercises, listening practice, and glossary support. Each phrase is in the guide and comes with an additional full explanation of both its meaning and nuances. You can access the guide through my student membership. The link to join is in the video description, or you can purchase it as a one-time download from my YouTube store for just $4.99. Okay, let's jump into our first topic, general intake and checkups. You'll hear each phrase twice for perfect pronunciation. The interpreter will now interpret everything said in the first person. The interpreter will now interpret everything said in the first person. Please speak directly to the patient, not to me. Please speak directly to the patient, not to me. Can you tell me the reason for your visit today? Can you tell me the reason for your visit today? Do you have any allergies to medication? Do you have any allergies to medication? How would you rate your pain on a scale from 1 to 10? How would you rate your pain on a scale from 1 to 10? Have you experienced this issue before? Have you experienced this issue before? When did symptoms start? When did symptoms start? Are you currently taking any medication? Are you currently taking any medication? Let me know if you'd like me to repeat or clarify anything. Let me know if you'd like me to repeat or clarify anything. I will interpret everything you say as accurately as possible. I will interpret everything you say as accurately as possible. Well done. These 10 phrases are essential tools for intake interviews, general checkups, and any appointment where you need to guide the communication clearly and professionally. Let's have our first question. Which phrase explains that the interpreter will speak in the voice of the patient using I and you? The correct answer is the interpreter will now interpret everything said in the first person. If you're enjoying the lesson so far, hit the like and subscribe. New medical English content drops every single week. Up next, we're heading into a more intense setting. Phrases for emergencies and urgent care. The doctor needs to ask some quick questions. Please answer briefly if you can. The doctor needs to ask some quick questions. Please answer briefly if you can. Can you point to where it hurts the most? Can you point to where it hurts the most? Are you having any difficulty breathing? Are you having any difficulty breathing? Have you lost consciousness at any point? Have you lost consciousness at any point? Do you have any chest pain or tightness? Do you have any chest pain or tightness? They're going to check your vital signs now. They're going to check your vital signs now. Please try to stay still. We're going to help you. Please try to stay still. We're going to help you. The doctor is on their way. The doctor is on their way. Can you describe what happened just before you collapsed? Can you describe what happened just before you collapsed? We're preparing you for imaging. Please remain calm. We're preparing you for imaging. Please remain calm. That was certainly a fast-paced section. These are moments when clear professional interpretation matters most. Okay, quiz time. Which phrase would you use when the doctor wants to quickly understand how a patient fainted? The correct answer is, can you describe what happened just before you collapsed? Well done if you got that right. If you're finding this lesson helpful so far, let me know in the comments. Which phrase are you most likely to use first? And don't forget, on student membership, you can download the guide for this lesson or pick it up in my YouTube store for $4.99. Next, let's turn to a critical part of any interpreter's work: supporting patients during procedures and medical interventions. We're going to begin the procedure now. We're going to begin the procedure now. You may feel some pressure, but it shouldn't be painful. You may feel some pressure, but it shouldn't be painful. The nurse is going to insert an IV. It may sting for a moment. The nurse is going to insert an IV. It might sting for a moment. Please lie still while we monitor your heart. Please lie still while we monitor your heart. They're going to numb the area first. They're going to numb the area first. You'll be under general anesthetic. You won't feel or remember anything. You'll be under general anesthetic. You won't feel or remember anything. We need your consent before we can continue. We need your consent before we can continue. Do you have any questions about the procedure? Do you have any questions about the procedure? The procedure is finished. You're in recovery now. The procedure is finished. You're in recovery now. You'll be monitored closely for the next few hours. You'll be monitored closely for the next few hours. Well done. These phrases are the backbone of safe, clear communication during procedures and treatments. Question time. Which phrase explains that the patient will be fully unconscious for surgery? Did you get it right? The correct answer is, you'll be under general anesthetic. You won't feel or remember anything. If you'd like to download all 100 phrases, along with language tips and extra exercises, check out the PDF guide for this lesson. It's really useful for medical interpreters. Now let's move on to one of the most sensitive interpreting environments, mental health and emotional support. Have you been feeling sad, anxious, or overwhelmed lately? Have you been feeling sad, anxious, or overwhelmed lately? How is your sleep? Are you having trouble falling or staying asleep? How is your sleep? Are you having trouble falling or staying asleep? Are you having any thoughts of harming yourself or others? Are you having any thoughts of harming yourself or others? Everything you share is confidential unless there is immediate risk. Everything you share is confidential unless there's immediate risk. Would you like to speak to a therapist or psychologist? Would you like to speak to a therapist or psychologist? You're not alone. There is help available. You're not alone. There is help available. They're here to listen and support you without judgment. They're here to listen and support you without judgment. It's okay to take your time. We can pause anytime. It's okay to take your time. We can pause anytime. Would you like to continue this conversation in a private space? Would you like to continue this conversation in a private space? Let me know if you feel unsafe at any time. Let me know if you feel unsafe at any time. That was a powerful and emotional section, and your role as an interpreter can make a life-changing difference in these moments. Okay, quiz time. Which phrase reminds the patient that everything they say is private unless there's a danger? Did you get it? The correct answer here is, everything you share is confidential unless there's immediate risk. Well done for getting that right. And that is 40 phrases under your belt already. Well done. Now let's move on to topic number 5, physical exams and diagnostics. We're going to look at phrases on how to interpret clearly during these procedures. The doctor is going to listen to your heart and lungs now. The doctor is going to listen to your heart and lungs now. Please take a deep breath in and out. Please take a deep breath in and out. Let me know if you feel any discomfort or pain. Let me know if you feel any discomfort or pain. I'm going to press here. Tell me if it's tender. I'm going to press here. Tell me if it's tender. We're going to take a blood sample now. We're going to take a blood sample now. You might feel a small pinch or sting. You might feel a small pinch or sting. We're sending this to the lab for testing. We're sending this to the lab for testing. Please change into this gown and let us know when you're ready. Please change into this gown and let us know when you're ready. You can close your eyes and try to relax. You can close your eyes and try to relax. We'll explain the results once they're available. We'll explain the results once they're available. Excellent work! These phrases are incredibly useful during routine exams, scans, and sample collection. Which of these phrases explains what happens after a blood test? The correct answer is, we're sending this to the lab for testing. Well done if you got that right. If you're finding this lesson valuable, consider becoming a student member. You'll get the full guide plus 70 additional PDFs from my directory and over 300 exclusive English lessons on my YouTube. Next up is topic 6, talking to family and support people during appointments. Would you like to have someone stay with you during the appointment? Would you like to have someone stay with you during the appointment? Your support person can stay in the room if you feel comfortable. Your support person can stay in the room if you feel comfortable. They're doing well. We're just monitoring them now. They're doing well. We're just monitoring them now. You're welcome to step outside if you need a break. You're welcome to step outside if you need a break. Would you like us to explain what's happening? Would you like us to explain what's happening? We'll give you an update as soon as we can. We'll give you an update as soon as we can. They're going to need some quiet time to recover. They're going to need some quiet time to recover. Please try not to overwhelm them with questions. Please try not to overwhelm them with questions. Do you have any concerns you'd like to address? Do you have any concerns you'd like to address? They're safe, stable, and being looked after. They're safe, stable, and being looked after. Well done! This section helps bridge communication between patients, families, and staff in a respectful, calm way. Quick quiz time. Which phrase gives a soft suggestion to let the patient rest without questions? Did you get it? The correct answer is, please try not to overwhelm them with questions. Well done for getting that right. Coming up is topic 7, phrases used when coordinating with medical teams behind the scenes. Can someone assist me in here, please? Can someone assist me in here, please? Let's quickly review the plan before we begin. Let's quickly review the plan before we begin. Vitals are stable, no changes since the last check. Vitals are stable, no changes since the last check. Could you prepare the meds while I set up the monitor? Could you prepare the meds while I set up the monitor? Patient is alert and responding appropriately. Patient is alert and responding appropriately. Let's debrief afterward to make sure everything's documented. Let's debrief afterward to make sure everything's documented. Can you double check her chart for allergies? Can you double check her chart for allergies? Let's call for the anaesthetist. She's requesting an epidural. Let's call for the anaesthetist. She's requesting an epidural. Do you want to escalate or wait another 10 minutes? Do you want to escalate or wait another 10 minutes? We'll update the family once things have stabilized here. We'll update the family once things have stabilized here. Great job. You are doing so well. These phrases are vital for working behind the scenes with the medical team, where accuracy, tone, and discretion all matter. Which phrase might be used when deciding whether to proceed with a clinical intervention? The correct answer is, do you want to escalate or wait another 10 minutes? Next, let's go into the delivery room, where communication moves fast and every word matters. You're fully dilated. It's time to start pushing. You're fully dilated. It's time to start pushing. Push when you feel the urge. Push when you feel the urge. Take a deep breath and push as hard as you can. Take a deep breath and push as hard as you can. Try to rest between contractions if you can. Try to rest between contractions if you can. I can see the baby's head. You're doing great. I can see the baby's head. You're doing great. Let's try a new position to help things progress. Let's try a new position to help things progress. We need to call the obstetric team now. We need to call the obstetric team now. You might feel burning. That's normal at this stage. You might feel burning. That's normal at this stage. One more big push. The shoulders are next. One more big push. The shoulders are next. The baby is here. You did it. The baby is here. You did it. That was a powerful section. These phrases help guide the most intense moments of life with dignity and calm. If you're looking for more phrases for midwives and maternity care, check out one of my recent lessons. I'll link it on screen and in the video description for you. Now let's have a quick question on these phrases. Which phrase prepares the patient for the sensation of crowning? Did you get it? The correct answer is, you might feel burning. That's normal at this stage. And wow, we're almost at the end. Next up is topic 9. We're turning to postnatal recovery and discharge communication. How are you feeling, physically and emotionally? How are you feeling, physically and emotionally? You may feel cramping. That's the uterus shrinking. You may feel cramping. That's the uterus shrinking. Let me know if you're in any pain so we can manage it. Let me know if you're in any pain so we can manage it. You're doing really well. It's completely normal to feel overwhelmed. You're doing really well. It's completely normal to feel overwhelmed. We'll check your stitches now. It may feel a little uncomfortable. We'll check your stitches now. It may feel a little uncomfortable. Try to rest when the baby is sleeping. Try to rest when the baby is sleeping. Let's talk about feeding options. What are your thoughts? Let's talk about feeding options. What are your thoughts? I'll show you how to hold the baby and I'll guide your hand. I'll show you how to hold the baby and I'll guide your hand. We'll monitor your vitals for the next few hours. We'll monitor your vitals for the next few hours. You'll receive some written information before you go home. You'll receive some written information before you go home. Great work. These phrases support recovery, safety, and confidence as the patient transitions to home care. Which of these phrases is used to help normalize the emotional intensity of the postpartum period? Did you get it? The correct answer is, you're doing really well. It's completely normal to feel overwhelmed. And now for our final topic, topic number 10, comfort, reassurance, and empowerment. These phrases are all about offering supportive empowerment every interpreter should know. You're not alone. We're here to support you. You're not alone. We're here to support you. It's okay to feel nervous. Many people do. It's okay to feel nervous. Many people do. There's no rush. Take your time. There's no rush. Take your time. You're doing more than enough. You're doing more than enough. You don't need to be perfect. Just do your best. You don't need to be perfect. Just do your best. If something doesn't feel right, speak up. If something doesn't feel right, speak up. You're safe here. We're doing everything we can. You're safe here. We're doing everything we can. Every situation is different. There's no right way to feel. Every situation is different. There's no right way to feel. We're with you every step of the way. We're with you every step of the way. You've done something incredible. You've done something incredible. And congratulations! You've just completed 100 phrases for medical interpreters, a full-length masterclass in professional, compassionate and clear communication across a wide range of medical situations. If you found this helpful, don't forget you can download the full PDF guide. The guide contains every phrase from this lesson, and every phrase comes with a language tip and explainer, really good for watching along with the video. The guide also includes a full glossary and additional exercises to really boost your comprehension. It's available right now for student members on the membership tab. Joining student membership with Learning English Pro is great value. For just $4.99 a month, you get access to every PDF guide I've ever made. That's running at 75 professional PDF guides. And with student membership, you'll also gain access to my library of over 300 English lessons. Join membership today, the link is in the video description, and gain access to a whole new world of English learning.